Well, good morning and welcome to our October 1st Friday presentation. My name's Mike. I'm a counselor at the Grand Rapids District Office. I've been with Michigan Rehabilitation Services for the past 6 years, and way back in the early 2000s, I had a 2-year stint as a blended staff. For most of the rest of the past 25 years or so, I've worked as a therapist in addiction treatment. Uh, I'm a master's limited licensed psychologist, and somewhere along the way, I also uh, earned certifications in trauma therapy and hypnotherapy. But here I am working as a folk rehab counselor and glad to be here. This is actually my third First Friday presentation and my first as a solo act. My good friend and colleague Cassandra, who did the last two of them with me, has moved into a different role within the agency, excuse me. So I'm on my own today. I had originally intended to put together an entirely new presentation today, but instead we'll be revisiting and extending some of the same material that was covered in the July 2023 First Friday. You know, I felt guilty about that at first, but then I remembered that there's been um, at least three Jaws movies, numerous Star Wars prequels and sequels, and I think the Fast and Furious franchise is up to 10 or 11 films now. So when I remembered that, I didn't feel so bad about repeating some material, and it relieved some pressure. So our topic today is, or the title of today's presentation rather, is Can My Therapist Help Me Get a Job? Well, the short answer is yes, maybe. Therapists aren't working as vocational rehab counselors. Vocational rehab counselors aren't working as therapists. But I believe both can potentially promote two qualities essential to navigating the world of work. Qualities we'll be discussing in more detail later, those being self-efficacy and resilience. So can my therapist help me get a job, at least indirectly, if the therapy promotes self-efficacy and resilience? Maybe not if the therapy reinforces a victim mentality. So one thing we're going to do today is examine a concerning trend in contemporary psychotherapy, which is the increasing influence of critical social justice on therapy. Um, some experts in the field, such as cognitive behavioral therapist Philip Pellegrino, uh, have expressed concern that this is more of a political, ideological approach than a therapeutic approach, and that it risks doing more harm than good. In fact, Dr. Pellegrino is concerned that these approaches to therapy uh, risk fostering anger, avoidant coping, blame, and hypervigilance in clients, all qualities that have been associated with decreased functioning and decreased overall psychological health. So here's our outline today. We'll briefly recap the July 2023 presentation, which was entitled Your Anxiety is Not Your Identity. We'll make sure to define those terms, self-efficacy and resilience. And then we'll talk more about this increased influence of critical social justice on therapies. This has sometimes been called the fifth force in counseling and therapy. Uh, this will extend the question that we asked last time: do therapists sometimes make matters worse? And please understand, I'm not here to beat up on therapists. I am one, or at least I have practiced as one. So this isn't about beating up on therapists. It's just about expressing concern about a trend that's happening in the profession. As part of that discussion, we'll revisit some material we covered previously on the risk of heightened sensitivity to what are called microaggressions. And then we'll compare and contrast cognitive behavioral therapy with the influence of critical social justice. And so I save my breath, and so I don't bore you to tears. Henceforth, I'm going to do my best to refer to cognitive behavioral therapy as CBT and critical social justice as CSJ. And so that this talk doesn't seem to be relentlessly negative, we're going to try to end on a positive note and talk about how rehab counselors and therapists might even be able to collaborate to promote our customers' well-being and success in employment. Because after all, that's what we're here for. And we'll try to accomplish all that in enough time that we can leave a little room for questions at the end. Emily is here to track questions in the chat, and we'll cover those at the end. One of the main sources I consulted for this presentation today is a recent book, a 2023 book that was edited by psychologist Val Thomas, who also co-founded an interesting website entitled Critical Therapy Antidote. The book's called Cynical Therapies, Perspectives on the Anti-Therapeutic Nature of Critical Social Justice. And Dr. Pellegrino, mentioned previously, contributed a chapter to that we'll consider a little later. Whether you agree with the perspectives presented in this book or not, this is a book that I do wish every counselor and therapist would read, and that every counseling student would read. I think it presents a valuable perspective that's worth considering. Well, I mentioned we're going to recap last July's presentation. So the concerning trend that we discussed then with implications for employment outcomes was what had seemed to us to be an increased number of applicants and customers who not only reported anxiety, but who seemed to construe anxiety as part of their conceptual identity, as who they are, at the expense of considering that anxiety is treatable, that it's sometimes curable, and that it's even sometimes useful. And we reviewed some cultural factors that seem to be contributing to this concerning trend, some contemporary cultural contributors to this trend. We asked the question if therapists might be making things worse, which is the question that we'll continue exploring today. And then, of course, we introduce those terms, resilience and self-efficacy. So what are some of the contemporary cultural contributors that we identified as factors in the rise of self-reports of anxiety? Well, one that some commentators have noted is well-intentioned efforts to try to shield people from stress and anxiety. This reinforces a belief that any anxiety or emotional discomfort is bad and must be avoided, and it might even foster or reinforce a culture of victimhood. At least Lisa Marchiano, a Jungian therapist, believes it does. We also noted the apparent tension or contradiction between the emerging identity-first language of various communities and the Americans with Disabilities Act's emphasis on person-first language. uh, Nicole Newman has called identity first language an expression of cultural diversity. But we were concerned that to view one's anxiety or other disability as one's culture courts the risk of becoming invested in not treating or overcoming it, assuming, of course, that it is treatable or resolvable. Because if my anxiety, for example, is my culture, then it's no longer what I have or what I do, it's who I am. Some other cultural contributors that we noted were the rising tide of young people on social media sites such as TikTok who portray themselves as having various self-diagnosed mental health disorders such as dissociative identity disorder, borderline personality, and Tourette's syndrome. We also discussed what Nick Haslam has called concept creep. What this refers to is the broadening and over-application of constructs such as trauma, safety, bullying, and violence. And according to Mr. Haslam, concept creep runs the risk of pathologizing our everyday experiences and encouraging a sense of what he called virtuous but impotent victimhood. And one example of concept creep is that some CSJ advocates have openly stated that speech can be violence if it elicits negative emotion or any level of discomfort. Also, one other cultural contributor is the uncritical acceptance and promotion of the microaggressions construct. Two places where you are likely to encounter that presented as uncontested fact are in college orientations and in implicit bias training. Critics of the microaggression construct, however, have referred to it as a kind of cognitive behavioral therapy in reverse. We'll discuss that more shortly as well. By CBT in reverse, we mean that heightened sensitivity to purported microaggressions courts the risk of reinforcing the very habits of mind that therapy is intended to help people resolve. Lisa Marciano, again, whose work we relied on at some length in last year's presentation, in an article she discussed about, entitled "Collision with Reality: What Depth Psychology Can Teach Us About Victimhood Culture and Teen Anxiety," encouraged us to strive to create a society in which we're encouraged to confront our anxiety and face difficult realities. She's of the opinion that this matters not just for individual mental health, but also for the well-being of society as a whole. Well, now that I've dropped the terms self-efficacy and resilience about 18 times, maybe we should define them. So, self-efficacy and resilience have been identified as two universal predictors of active coping during stress. Both of them are teachable, so let's see if we can find out what they are. So resilience refers to the ability to bounce back, to cope in the face of adversity, to flexibly use emotional resources to meet the demands of stressful situations, and to bend without breaking when faced with hardship or difficulty. Now, some of us are higher in resilience, some of us are lower in resilience. There are lots of contributors to that: personality differences, formative experiences, social learning. Lots of factors contribute to that. But The good news about resilience is at least some researchers believe it can be taught. So even potentially someone lower in resilience could learn to cultivate more of it. None of us are probably ever going to be perfect with this or anything else, but some steps that one can take, uh, possibly with the aid of a therapist, to cultivate resilience include one, learning when certain emotions are adaptive. One problem with construing any negative emotionality uh, as a problem, or any emotional discomfort as a problem, is it overlooks the fact that sometimes fear is useful, sometimes anger is useful. They're only problems when we get stuck in them, when they become pervasive, or when they get acted out in destructive ways. Also, learning specific techniques for regulating both our positive and negative emotions. Uh, the positive psychology movement has contributed quite a bit in this area. And then working to build strong, healthy social and emotional relationships with others. These are some steps to cultivate resilience. Well, how about self-efficacy? What is that? Um, it is also referred to as efficacy expectations. It's a term that was coined by the social learning theorist Albert Bandura. And it refers to the belief or the confidence that you can do what you need to do to get the results or the outcomes that you want. Now, as with confidence, we need to be clear that the beliefs or the expectations alone don't necessarily automatically translate into uh, actual skill or ability. But part of the idea here is that um, in the absence of self-efficacy or efficacy expectations, we're not even going to try. So we need some degree of self-efficacy or efficacy expectations to even be willing to try new things, to step out of our comfort zone. And Bandura was of the opinion that all effective therapies, regardless of theoretical orientation, so whether we're talking behaviorism, psychoanalysis, person-centered therapy, that all effective therapies uh, are effective because they increase the level and strength of self-efficacy. So one way to gauge whether or not a therapy is working, whether or not a therapy is actually helping somebody, is if that person now feels capable of accomplishing things that they didn't, accomplishing, managing, or confronting things that they did not previously feel able to manage. And one concern about the rising tide of CSJ in the psychotherapy is that, at least according to psychologist Val Thomas, uh, it's actually anti-therapeutic, rather than, in other words, rather than promoting self-efficacy, it tends to promote a victim mentality. Well, where do we get self-efficacy expectations if we're lacking in them? Well, one is through performance accomplishments, meaning actual experiences of success. Another is through vicarious experience, which is a fancy way of saying seeing others uh, accomplish things. Bandura thought we learn a whole lot of what we learn through modeling. Not modeling in the sense of looking glamorous on the runway, but in the sense of observing other people uh, engaging in behavior. So vicarious experience then amounts to, gosh, if he can do it, maybe I can too. Maybe I'm able to do that same thing. Verbal persuasion, which although actually considered the weakest of these five, as I understand it, is also something that both therapists and rehab counselors are certainly able to provide. Verbal persuasion, verbal encouragement. By emotional and physiological states, what's meant there is learning to regulate our autonomic arousal, learning to manage our reactions through such practices as, for example, relaxation training. And then finally, imaginal experiences. This would include things like the visualization that athletes and performing artists engage in before approaching some kind of difficult or challenging play or performance. Well, so again, we could say then that any counseling or therapy approach is potentially effective if, however it does it, it promotes self-efficacy and resilience. So what are those counseling and therapy approaches that are out there? Speaking very broadly, we could say that in the history of psychotherapy, there have been at least five forces. The first force is generally considered to be psychoanalysis and the psychodynamic approaches. These are characterized by an emphasis, well, first of all, on the persisting impact of early childhood experiences, but also on an emphasis on unconscious processes. There's more to the picture than meets the eye. What's most important isn't what appears on the surface, but what's going on unconsciously, what's going on below the surface. The kind of lens that a psychoanalyst might use to in encountering a patient is sometimes called a hermeneutic of suspicion, which is a word that you can astound your friends at parties with. It basically means an interpretive framework. This is sometimes illustrated by an old joke. Two psychoanalysts at the Psychoanalytic Institute encountered each other in the hallway. One said, "Good morning, how are you?" The other one said, I wonder what he meant by that." The second force came out of the behaviorist movement and placed much more emphasis on overt behavior, on changing overt behavior, and was very closely aligned with scientific methodology. It eventually also incorporated attention to cognition, to thoughts, and to the impact of thought and thinking on emotion and behavior. And so that's where CBT, or cognitive behavioral therapy, comes from. And again, this approach places more emphasis on evidence, on scientific method. And then along came what's been called the third force. That refers to humanistic psychotherapy. A couple emphases of this approach were, one, authenticity, and two, recognizing the therapeutic impact of the therapy relationship itself, the quality of the relationship. That's where you hear things like unconditional positive regard and terms like that. And excuse me, this became very influential. You know, historically, the behaviorists especially weren't too concerned about the relationship. It's like, who wants that touchy-feely stuff? We're just going to change behavior. And then somewhere along the line, they realized that, well, even though we don't buy everything those humanistic folks say, gosh, maybe we get better results if we establish a quality relationship with our clients before we try to change their behavior. And so that's been enormously influential in other forms of therapy as well. There are a couple of contenders for the fourth force, but for time's sake, we won't belabor that point. But in a general sense, we could say that the fourth force refers to things like integrative or biopsychosocial therapies and postmodern approaches, and the common denominator there is more recognition of how context and culture shape experience. By the way, ideally, these four forces aren't necessarily mutually exclusive. Each addresses a different aspect of the whole person, and each might be more useful for any given person at a given time. Now, some commentators, I hope I'm pronouncing their names correctly, Floridis and Krafchick, have dubbed the rise of critical social justice, the CSJ influence in contemporary counseling. They've dubbed this a fifth force. And if the first force was characterized by that fancy word we used, a hermeneutic of suspicion, this force, according to these commentators, is characterized by a hermeneutic of oppression. Power is the ground of human societal experience, and each person's experience of power is determined by his membership in groups deemed to be either oppressors or oppressed. So this is why some folks, such as those contributors to the book I mentioned earlier, are concerned, because many therapists are now practicing under the influence of CSJ and the various other critical theories, such as critical race theory and queer theory. Mental health therapists themselves may be fostering the very problems they're expected to treat. At least psychologist Val Tarico believes so. These therapists tend to emphasize collective influences on mental health, such as race, gender, identity, over and above exploring internal contributors to clients' problems, such as negative emotionality, beliefs and assumptions, lifestyle factors, and so on. And they may tend to validate clients' feelings and perceptions at the expense of encouraging them to examine their own assumptions. And this is one way that this approach is contrary to or antithetical to CBT. So we'll do our best in the limited time we have to define a few terms that we're tossing around here, or that I'm tossing around here. Critical theory generally refers to a post-Marxist analysis of society in terms of systems of power. It emphasizes societal change. And since its beginnings in the 1930s in the work of Max Horkheimer, among others, it's broadened to include postmodern perspectives on the nature of truth and the power of language. Knowledge is socially constructed. It's defined through language by the culture in which we live. CSJ then is an umbrella term for the contemporary set of all the various critical theories. So it involves a radical political approach to achieving social justice, tends to see the world in terms of group identities and an oppressor-oppressed dynamic, or a privileged marginalized dynamic. And it involves an activist dimension that aims to find problems, to disrupt and dismantle societal norms, to center the marginalized, and to privilege subjective truth over objective truth. Val Thomas, the editor and primary contributor to Cynical Therapies, maintains that this is becoming the status quo in counseling and therapy. And this trend amounts then to a hybrid of psychotherapy and political ideology. And to clarify, we should differentiate two uses of the word critical. When people talk about critical theory, they're not talking about the same thing as critical thinking. Those two terms are sometimes confused, at least in the popular mind. When we're talking about critical theory, we're talking about movement with both a theory and practice that strives to cultivate what's called a critical consciousness, a consciousness that's geared specifically toward identifying and exposing social and cultural problems in order to bring about revolutionary political change. This is contrasted with critical thinking, which is more aligned with scientific method, which is concerned with gathering information, with identifying assumptions, weighing and considering evidence, and considering alternative hypotheses. And what are the risks of CSJ influencing therapy? Well, it tends to place an emphasis on group identification at the expense of individual factors and concerns. And its political ideological emphasis shifts the focus then from helping individual clients make changes in their lives to either complaining about or trying to change the larger society. For those clients perceived to be oppressed or marginalized, it may risk reinforcing or exacerbating a victim mentality rather than empowering them. And for those clients or customers perceived to belong to an oppressor group, it could risk fostering inappropriate guilt and shame. And as noted previously, some aspects of it encourage the very habits of mind that psychotherapy is intended to undo. It may also promote avoidance-based accommodations that could worsen clients' anxiety. Well, let's look at an actual example of a therapist who at least advertises in CSJ terms. This is retrieved from an actual therapy practices website in Michigan. I've altered the wording slightly in an attempt to preserve the practitioner's anonymity, but this is the heart of this is exactly what was conveyed on the website. This therapist wrote in an online bio, "I am convinced that most mental and emotional distress has its roots in white supremacy, patriarchy, transphobia, ableism, homophobia, and class oppression." Well, two thoughts there. One, this reminds me of, or makes me think of a doctor who advertises that almost all chronic coughs are caused by dust mites. Some of the time it is, but what about the times that that's not the problem? What about the times something else is happening? If we have a foregone conclusion about cause, we might fall far afield of the actual issue. Secondly, I want to be fair. I don't know this person. We know from research that how people actually practice therapy doesn't always align with their theoretical orientation, and therapists can and do get excellent results if they're able to foster a healthy relationship with their clients. So with that in mind, this therapist might be getting excellent results. Nevertheless, I would be extremely reluctant to refer a depressed, middle-aged, white, working-class man to a therapist who advertised or who espoused this kind of an attitude. Let's contrast this with how philosopher Alan Watts described the therapist's role a very long time ago. He said the task of the psychotherapist is to bring about a reconciliation between individual feeling and social norms without sacrificing the integrity of the individual. He said therapists try to help individuals be themselves without giving unnecessary offense to their community, to be in the world of social convention, but not of the world. Now, he also recognized that to do that, it really often did require some critique of the social systems or social structures in which the client was living and moving and having his or her being. But he didn't believe that that necessarily required taking an activist stance. He said the therapist who's really interested in helping people is forced into social criticism. This doesn't mean that he has to engage directly in political revolution. It does mean that he has to help the individual liberate himself from various forms of social conditioning, which includes liberation from hating the conditioning, because hatred itself is a form of bondage to its object. Well, we've mentioned that one of the forms of therapy that is out there is CBT, or cognitive behavioral therapy. The basic idea of CBT is that how you would think affects what you do and how you feel. It's based on the generic cognitive model, which says, in effect, that every psychological problem, no matter what caused it, results in some distorted ways of thinking, and that it is possible to help people recognize and replace distorted ways of thinking that are causing emotional distress, and in so doing, relieve at least some distress. Those kinds of thoughts are called cognitive distortions. And some examples of categories of cognitive distortions are emotional reasoning. If I feel it, it must be true. Mind reading. I know what you're thinking, and I'm really upset about it. And catastrophizing, going from zero to worst case scenario and then reacting emotionally to the imagined worst case scenario. We all do some of these some of the time. But the idea here is when these become habitual, pervasive, and automatic, they cause emotional distress. Now, some proponents of CBT call it the gold standard of therapy. It is the most researched form of psychotherapy. But in my opinion, that doesn't mean it's the one and only true. For example, there is research to suggest that CBT may be more effective with anxiety than it is with depression. And also that psychodynamic psychotherapy may yield longer lasting results with depression than CBT. When I was practicing as a therapist, I certainly borrowed from CBT, but I didn't rely on it exclusively, nor did I consider myself primarily a CBT therapist. Nevertheless, CBT has received the most research support. And of course, one of its aims is to train people not to catastrophize and interpret every situation as negatively as possible, and also to develop a more positive or resilient attitude toward the world. This is where it seems antithetical to the kind of uncritical promotion of the microaggressions concept that has emerged in recent years. Darren Wing Su popularized the microaggression concept back in 2007. The term was actually coined much earlier. What it refers to are subtle snubs, slights, and insults, whether intentional or unintentional, directed toward members of historically marginalized or stigmatized groups. And certainly we all recognize that people can be clods, people can be unthinking, people can be passive aggressive. No one's denying that those things happen. And when those things happen, they do indeed need to be called out. But several critics of this microaggression concept believe that it amounts to a kind of cognitive therapy in reverse, because it's based entirely on the subjective reaction of the purported victim without regard to the intention of the purported perpetrator. And so it fosters and reinforces the kind of thinking and reacting that cognitive behavioral therapy is intended to help people resolve. It perpetuates, potentially at least, a victim culture. And it does indeed appear to foster cognitive distortions. By Su's 2007 description of microaggressions, it includes unintentional slights. I'm sorry, let me restate that. Su's 2007 description of microaggressions includes unintentional slights and defines them entirely in terms of the recipient's subjective interpretation. That is the cognitive distortion of emotional reasoning. The very word aggression implicitly attributes intention to the purported perpetrator and perpetuates a victim-perpetrator dynamic. And yet, confusingly, advocates of the microaggression concept maintain that such behaviors are typically unintentional. Lukianoff and Haidt, in their book, The Coddling of the American Mind, note that assuming the worst about other people and reading their actions as uncharitably as possible amounts to the cognitive distortion called mind reading. And they contend that by Su's logic, CBT itself could be viewed as a microaggression because it requires questioning the premises and assumptions that give rise to feelings. I'd like to share an example that was given at an implicit bias training I attended a couple years ago. The presenter not only introduced the concept of microaggressions uncritically and as uncontested fact, but then proceeded to use the following as an illustration or an example of a microaggression. The presenter said, a visitor to a hospital approached a woman of color in the corridor. He asked her, "Are you the nurse?" In fact, she was the doctor. The implicit bias training presenter asserted that this amounted to a microaggression because the very question assumed that the woman held a lower status position in the hospital. But now here's something that the trainer or the presenter didn't consider. In the hospital hierarchy, doctors have far more power than nurses. So if the doctor truly took offense at being mistaken for a nurse, wouldn't that in turn be a microaggression against the entire nursing profession? Food for thought. Well, earlier I mentioned Dr. Pellegrino. He contributed a chapter to cynical therapies entitled CBT and CSJ are incompatible. For time's sake, we may need to just simply note that he listed 4 core principles of CBT therapy and then proceeded to discuss how the CSJ influence therapy would be contrary to each. I will refer you to the chapter in his book or to his website if you're interested in more information on that. And he concluded his chapter by reiterating the price of the CSJ influence in contemporary psychotherapy. He is concerned that it not only keeps people focused outward at the expense, focused outward on things they can't control at the expense of cultivating a more internal locus of control, more a greater sense of empowerment. He believes that this influence in psychotherapy doesn't allow people to grow, learn new skills, learn new things about self and others. And as noted previously, instead it risks fostering an ongoing state of anger, avoidance, blame, hypervigilance, all of which are associated with decreased functioning and decreased overall psychological health. Well, now that I've probably sounded a little negative for a while, let's shift gears and see what could therapists, how could VR counselors and therapists potentially work together to promote our customers' well-being. I think the principle of charity requires avoiding the appearance of either meddling in or second guessing our customers' therapy and therapists, whether or not we have some reservations about the therapist's approach. At the same time, it may be helpful to understand from both the customers and their therapist perspective how and whether the therapy is promoting resilience and self-efficacy. We should also try in consultation with the therapist to strive for clarity. When must we accommodate anxiety and other psychological or behavioral conditions that either can't change or will require extensive time and support to change? And when do we create a risk of merely enabling dysfunctional or self-defeating behavior at the expense of encouraging resilience and self-efficacy? So some questions to explore in consultation with our customers' therapists might be, how is the therapy helping the client or customer manage stress, reduce anxiety, increase active coping, decrease avoidant coping, and so forth? In other words, how is the therapy helping the client or customer develop resilience and self-efficacy? What else could we do? Well, we could, again, potentially in consultation with the therapist, coordinate some efforts to build resilience and self-efficacy and to increase customers' distress tolerance and to encourage customers to accept that growth almost always involves at least some discomfort. And some resources that we at some resources that we at MRS can offer in that regard include work-based learning experiences, trial work experiences, participation in the job readiness classes that are occasionally offered here at the Grand Rapids office, and so on. We can also take a cue from CBT and try where realistic and appropriate to promote our customers' ability to consider alternate explanations and hypotheses. For example, a customer who has had repeated experiences of feeling picked on at work and so has abruptly walked off of jobs or otherwise acted out. We don't have to automatically either accept or reject the customer's interpretation of that, but we could certainly gently encourage and invite the customer to consider alternate explanations of what might be happening there and to experiment with different attitudes, different behaviors, and so on. We can also try to not only offer realistic encouragement, but point our customers toward resources and opportunities to challenge self-imposed limitations. And finally, we could, again, potentially in concert with the therapist, encourage customers to write relapse prevention plans, not only to prevent relapses of substance use disorders, but also to anticipate how to manage risky situations and reactions generally. Gosh, you've walked off of a few jobs because you got stressed or upset. Chances are really good you're going to feel vulnerable to that again in the future. So let's come up with a plan for what alternatives you have if you're starting to feel that way. Some of that kind of planning, I think that could be again, even though we're not working here as therapists, that could be another way that we could contribute to promoting those two qualities mentioned so frequently today, self-efficacy and resilience. That's about all I have time for today, but I am certainly open to entertaining your questions if you have any.
Okay, we've got one question so far. Could there be a middle ground where therapists acknowledge the presence of societal problems and injustices, but encourage clients to respond to and mount against these factors rather than succumb to them?
Yes, absolutely. In fact, I'm glad you asked that because I think that's what that's really what I'm encouraging today. I think the risk that critics of the CSJ influence on therapy, and I would include myself among them, I think the risk that's there is that it imbalances, it tilts things too far in a direction away from that middle ground where that Alan Watts advocated when he recognized that you can't really do therapy without at least some criticism or critique of social structures and systems. But if you go totally in the activist direction, then that could occur at the expense of really helping the client grow.
All right, thank you. I'm not seeing any other questions.
Okay, well, absent any other questions, I guess we're done.
Oh, sorry, Mike, we got one more. Can I jump back
Okay.
in?
All right.
Going back to how CSJ encourages activism and societal change, why would that not feel at least somewhat empowering to a patient who has been feeling completely helpless?
It could feel empowering if it's not occurring at the expense of cultivating other appropriate skills, and attitudes. I mean, I think everybody agrees that there are problems in society. I don't think anybody, including the contributors to this book, would deny that. I think the concern is that going too far in that direction could be disempowering because it keeps the focus outward. It's I'm a victim of this or that social system at the expense of, even though this or that social system isn't cool, here's things that I'm learning to do to take care of myself. And sometimes taking care of yourself is changing your attitude about things.
All right, thank you, Mike. That's all I'm seeing for the Q&A.
All right, well, thank you. I don't know how many of you are out there, but thank you to everybody who listened today, and thank you to those of you who asked questions. And I hope something here was at least mildly interesting or useful to you. So all the best to you all.